My name is Ajay Sampat, and I'm an associate clinical professor of neurology at the University of California, Davis. I'm also a father of two young children, a husband, son, and brother, and in the cruelest twist of irony, also a person who is living with ALS. I'd like to present 3 points about why NurOwn should be approved from my dual perspective as a board-certified academic neurologist and as a person who is living with this disease. Next slide, please. ALS is a clinically heterogeneous disease which presents and progresses differently in each individual. As a result of this clinical heterogeneity, it will take an equally diverse therapeutic cocktail to make a tangible impact on progression rate and survival. As the only potential therapeutic in sporadic ALS that has an intrathecal method of delivery, NurOwn offers a particular promise that other approved treatments do not have, an advantageous method of delivery that bypasses the blood-brain barrier. The second key factor that separates NurOwn from the current FDA-approved treatments is its seminal biomarker effect across the disease spectrum, not seen in any of the current approved therapies for sporadic ALS. NurOwn was found to reduce biomarkers associated with neurodegeneration and neuroinflammation and increase markers associated with neuroprotection. Now, as a neurologist, I always feel more confident when there is objective data that correlate with clinical outcome. And while these two facts are important, the most compelling argument I can make for the approval of this drug is its role in preserving function, which is beyond clinically meaningful for every ALS individual and their families. Next slide, please. The phase 3 trial of NurOwn demonstrated on average a 2-point slowing of progression on the ALS-FRS scale for 77% of trial participants over 28 weeks. While this may not seem like a lot, for someone living with ALS, 2 points are significant and clinically meaningful. For me in particular, those 2 points could mean the difference between reading my kids a bedtime story at night or not. It could mean the difference between using my BiPAP device only at night or having to use it during the day as well. It could mean the difference between me being able to still give lectures as a clinical educator or losing yet another vital part of my identity. Any preservation of function as someone living with ALS is clinically meaningful. Please don't discount the human experience in this horrific disease. And remember, there is no risk worse than a certain death from a 100% fatal condition. As a neurologist, if I were counseling a patient in my clinic, my risk-benefit deliberations would focus on the favorable safety profile of this drug, the critical unmet need of ALS with no other viable treatment alternative, and the potential for even modest improvements in a patient's quality of life. As a neurologist, I would feel confident recommending this therapy to my patients. And as an ALS patient, I would feel confident accepting this therapy from my neurologist. Please vote to approve NurOwn for all people living with ALS. Thank you.